Hello everyone. I'm going to talk about the needs of an incident learning system in the Middle East. I just started with the Middle East, but then I elaborate to other countries, the Eastern Mediterranean region and Turkey, which is called Europe. So, as you know, radiation therapy is one of the main treatment modalities that is provided for our patient, for either curative or palliative cancer patient. And the radiation therapy, it's a multi-stage process, can involve different type of techniques and utilizing various technologies also. And for this reason, we need a high level of accuracy for each radiotherapy step. Besides that, ensuring the safety of the patient and the quality of the treatment is really important. With growing experience in quality improvement, so using incident learning system, there is a growing of literature exploring the potential cause of error and steps to prevent the errors. Next slide. I cannot control from here, excuse me.
Can you pause a second?
Yes. So Pierre will give me extra time, right?
It's not extra, it's your right foot line.
Okay. Okay. The quality and safety of radiation therapy, if we're going to talk about that, the quality in healthcare generally it's a right to be provided for an individual and populations, and I think Dr. Ghada, she explained this in a previous talk. If we're going to talk about the quality in radiation therapy, according to the AAFMTG report 100, those are the features which meet the needs of the patient, considering all the medical, physiological, and economic goals also, in addition to the professional and economic needs for caregivers and the institutes. Besides that, it's the clinical process which is designed to realize the cancer treatment that conform which nationality accepted the standard of practice and specification and freedom of should be freedom from errors and mistakes. Next, please. Technology in radiation therapy. 1 month back, I've attended the CARO conference, and there was the award of this year for COMP. They gave an award for Dr. Michael Evans. And in that talk, he showed how those people, they started from the beginning, like Prof. Pugorshag with Prof. Gino and Michael Evans and all the other physicists. So literally, they started from basic thing, from very simple thing. So he showed so many pictures while he was talking. When I was there and I saw that, I was like, we are really in there is a significant increase or a significant improvement in radiation therapy from back then until now. Even if you look like 10 years back, you'll see a big improvement in radiation therapy and all technologies used. And all of these technologies can introduce new errors. It has to do with the software. It can be either communication failure between computers and or software bugs. So radiation therapy is increasing worldwide, and because of that, there is a serious and fatal radiotherapy accidents. It can be reported, but we don't know whether it's reported or not. So it is incidents, accidents, and near misses. And so it is our responsibility as radiotherapy caregivers to reduce those incidents as much as possible. So having a system to report all these incidents and near misses is really important to learn from each other. Considering the accident and medical uses of ionizing radiation, you should also considering the increase of a number of population as well. So in a study seen here, there is a total number of radiotherapy treatment and radiopharmaceutical treatment for the same period. It was estimated to be around 0.9 million annually. So there is a rapid increase. And those groups here, they reported the cause of incidents based on saffron from the IAEA between December 2012 and December 2021. And the main reason for all these incidents was lack of communication or miscommunication. The second reason also the identified or the inadequate risk assessment. In my opinion, not only because of lack of communication or miscommunication, we have to have a good way of communicating in order to find the important reason for all types of incidents. Before talking about the incident learning system, in my opinion, there is a very important terminology we have to know about it, because so many people, they don't distinguish between incident and near misses. So this is terminology provided by the IAEA. Incident is any intended event that can cause error in equipment failure or any mishaps. And near misses is a potential significant event that could have occurred as a consequence of actual occurrence, but didn't occur owing to the condition or prevailing at that time. This simple picture can explain for you like what is the difference between near miss and incident. And so, in order to learn from all these incidents, we have to have an incident reporting system, and which is include immediate response to an incident, to remove immediate dangers, to restore the facility to normal operation as soon as possible. So, talking about existing incident reporting system worldwide, there is the Safety in Radiation Oncology by the IAEA, which is called SAFRON, and UK system, they have Safer Radiotherapy. And there is ROSIS, which is Radiation Oncology Safety Education and Information System in Europe, available in Europe, and there is ROILS, Radiation Oncology Incident Learning System in US. Today I'm gonna give an example about the Saffron only, but all these, I think only Saffron is available. You can get an account from the IAEA, you can access that, you can also you can learn from other people experience on this matter. So this is the distribution of incident over time based on Saffron from all this year, and you can see the number of incident. Sometimes included. This is this year, which is still not yet finished. But this time, I downloaded this picture in October. Here, I think there was little less number of incidents. I would assume because of COVID era at that time. But I think people are reporting because also they want to learn from other people. This is an example of one incident shown in Saffron, and it will. I'll just show this example in order to show you how people can report incidents. So they will choose the modality, who discovered the incident, if there is anybody affected, patient affected or not, and there is a description of the incident itself. And after that, this website, they give you they will give documents or the extra details in case how to solve or sort out such an incident in the future. An example can be related to our culture. A study shows that is, which is similarity of patient name. 38% of near misses was in patient identification. That this study was done in Saudi Arabia. This is a good example for our region. Because we have a lot of common names, and it can happen in every center or in every hospital. So I gathered information from our region because we don't have a system or a platform which we can learn from each other. According to DIRECT, which is Directory of Radiation Oncology, in the IAEA website again, the status of our radiotherapy in the region. We have 448 centers. This is only for the first center, so can you imagine how many machines we have, how many patients were treated? So, in my opinion, we can learn from each other, since we are in the same region, we have a common culture, we can learn from each other. So I've done a survey, I've sent it to different centers, and the purpose was the survey to establish a culture of safety that paramount at every facility involved in the care of patients using radiation therapy. And because, as I said, this region has a unique culture aspect that can affect radiation therapy safety and patient care, and also to highlight the need of establishment comprehensive radiation therapy incident learning system in the IMRO and Turkey region. So we have collected the data using REDCap, which is electronic data capture tool, which was hosted at Sultan Qaboos Comprehensive Cancer Center. And the survey was distributed to different radiation oncologists, medical physicists, and therapists as well, and radiation protection officers. And I would like to thank MISTRO and MIFOMP also for helping distributing this survey to different people. And in this survey, we have put some questions, which is not limited, but to the following question, which is classification of institute, whether it's private or government, the number of patients treated in each institute annually, the treatment techniques and technologies used. And we asked them if they have any existing incident learning system, or are they also following any international guidelines, and who is responsible to report all the incidents, and are they discussing those incidents with the team or not? So interestingly, we found that the survey was distributed to around 671. By the time I was preparing this presentation, 109 replies in 1 month, and 59% of the response were from a government hospital, and 61% had a radiation safety program in their place. 46% have an incident learning system. 27% of them, they don't know what is even incident learning system. And the major barriers they identify was because of the absence of leadership support by 50%, and also the non-existence of culture of creating an incident learning system. And there was a strong agreement among all the respondents to create a unified incident learning system by 82.7%. I'm going to show you some questions which was part of the survey, like, do you have any incident learning system? So majority of them they have. 28% they don't have. 27% they don't know what is the incident learning system is. And the other question, do your facility have any following program that are operational, like incident learning system? Majority they have safety program. They are doing also quality assurance, which is really good. They have radiation safety committees by 55%, and there is a designated radiation safety or quality control officer who oversees the program by 46.7%. Again, the question, what was the main reason for not implementing any incident learning system of your facility? And the majority of the 50% reported that because of the lack of support from leadership. And this is a message for any leadership person here, that this thing is really important in our region. And other things, other reasons like their fear of exploring radiation therapy incident to external community. There is also the culture of implementing incident learning system does not exist, and also fear of repercussions on the healthcare workers. And most of there is a like 30% is lack of cultural safety in the facility. And the main question, to what extent you agree with that we have an incident learning system in our for radiation oncology centers in the Middle East, and there is an agreement by 76.6%. I would like to conclude at the despite the obvious systematic bias with only 15.6% respond to this survey, it's clearly that there is a need to establish a regional incident learning system in our region. And also there is a need to support from institution leadership. I would like to thank all the people who were part of distributing the survey and helping me. Professor Sefo was one of them, thank you so much. Dr. Zahid, Dr. Nadeem, Dr. Sarjan, Dr. Salim, Mr. Mahmoud, and Mr. Ibrahim from Iraq as well. And please, if you didn't fill the survey, if you didn't receive it, you can scan the barcode and helping me gathering more data in order to finish this survey. And this is a call from me through MISTRO that we need to have a unified platform for incident learning system in our region. And this is really important to learn from each other. Thank you so much.